One that they're not talking about is a very important study on the leaching of lead from pipes with brass, okay? At 2 parts per million. 2 parts per million. They were showing in the presence of chloramine, a water treatment, which Portland has, it leaches lead from brass, which has lead. Now, wouldn't you think that if it's leaching lead at 2 parts per million, they'd want to test it at 0.7, and yet they haven't done the test. This is the kind of research that has not been done and is putting us at risk. And as far as this optimal they keep talking about, the best study out there, the Iowa study that's measuring total fluoride intake, not just from water, it's a much higher level study, an excellent study. Even they said that the word optimal is problematic.
Let me just be clear that, because this assertions have been thrown out all night, that almost any fluoride is bad. Simply not true, because if that was the case, we would have a lot more problems, as Mike has indicated, throughout the country. 3/4 of the American population are already exposed to fluoride. We have 60 years of data and science that show that there is no adverse health effects at these levels. Moreover, Portland water is already fluoridated at 0.1 parts per million. So this notion that any fluoride is bad for you is simply not consistent with the truth. Now, at 0.7 parts per million, what we're optimizing are the health benefits and reducing the potentially detrimental health effects. That is the sweet spot. At 2 parts per million, we're talking about different kinds of interactions. Concentration matters. It's the amount of molecules that you have on a volume of liquid in this particular case. And at 0.7, there's not enough fluoride molecules to have the kind of impact that Rick is talking about. So optimal fluoridation does matter.
Thank you. So I'm going to suggest a change in format, since we have so many questions and so little time left, that we stop doing the rebuttals, if that's all right. So just do the 2 minutes each side. Okay, this is for the pro side. What is the effectiveness of water fluoridation compared to topical application?
Well, both are effective. Topical application is the most profound direct effect on the enamel, which is the hard shell that surrounds the tooth. When enamel breaks down, the effect of fluoride is that fluoride enters the tooth, enters the surface of the tooth, it hardens it, remineralizes it. It actually becomes harder than it was prior. It goes from being what's called hydroxyapatite, which is decayed by acid, to fluoroapatite. That's harder than hydroxyapatite. So there is a strong topical effect. And when you optimally fluoridate the water, you do several things. One, you standardize and regulate the concentration of fluoride in the water daily. And you create a consistent concentration and titer in the saliva that has a strong topical effect consistently over the day on the tooth. The science of this is effectively this. The tooth can demineralize. If you drink some soda pop, you get that chalky feeling on your tooth. It's demineralized, it's acid. And then the bacteria produce acid from the sugar, and then you get further erosion. If you just do that as a treat, it's probably no big deal. But when you do it consistently over time, what you get is your mouth pH breaks down to the acidic side, and you get consistent tooth decay. That's where you get children with these rampant decay in adults. By having fluoride consistently in the mouth at optimal levels, you create a harder enamel structure, more impervious to the decay of the acid. And you don't have to take my word for it. The American Dental Association, the American Association of Public Health Dentistry, the American Association of Public Health, the Center for Disease Control, the Office of the Surgeon General. I'm not just making this up, and I didn't scramble around and find some studies. Thousands of studies have been evaluated by all these organizations, come to the same conclusion.
First off, these thousands of studies have never been a randomized controlled trial. That is the gold standard of medicine, to show safety or effectiveness of a product or drug. Secondly, a SURE report that recently came out in Europe indicated that water fluoridation is no more beneficial at all than topical fluoride. We've talked tonight that the CDC and the FDA and the National Academy of Sciences all agree the benefit of fluoride is topical. We've also talked about research showing that this benefit is at 1,000 parts per million, not 0.7. Why are we swallowing more contaminants when the benefit of this policy is topical? We did a good job illustrating that based on the hydroxyapatite structure. Fluorine disrupts that structure, it's true. It used to be believed in the bone density literature that that made bone stronger. That's what they say about the teeth. However, while initial DEXA scores, bone density scores, improved, those individuals had more risk of fractures. Disrupting nature's way of having bone matrix on our teeth with known contaminants does not make sense. Already, 41% of our kids have visible signs of overexposure. They keep telling us it's just white spots, just stronger teeth. We're disrupting the bone matrix. In addition, again, the benefit of this policy is topical. Why are we adding more contaminants to our kids' water when we have better solutions already here and already present? Got a little upset about that Tribune story. It might be that the article is actually accurate and we could train dental therapists right here for the pilot study. I don't know why they're not willing to do that on the Hill, but it seems like a good solution. It seems like we can get more kids needing access, as you spoke about tonight. We don't need more chemicals in our water.
Okay, so we are going to do another 2-minute question, starting with the con side. King County's SMILE study shows that poverty, race, and immigrant status is the major cause of cavities. Oregon has just 11 low-income dental offices. Would greater dental services have a greater impact than fluoride?
Yes.
Well, absolutely. If we had more clinics and more access for our kids, those kids would have better service. There are a lot of solutions. There are many solutions. One, the topical programs that we have in our school are already available, including dental sealants. The Oregon Health Authority was on record as of February 14th saying that those two programs combined prevent almost 100% of dental decay. That website has since changed. I'm not really sure why. In addition, we talked a little bit about the First Tooth Project. Sounds like you like it. Sounds like you're involved with it. This project is allowing earlier intervention. It's allowing pediatricians to pick up when we need to get our kids into access. The pilot study that was mentioned in the Tribune article has successfully been used in Alaska in very low-income areas where their dental decay is really very high. And the success of that program has been targeting low-income kids. And that's really what we're talking about here. We're talking about low-income kids with a policy that has not been shown to help them. You talk about it being effective, but the truth is the largest study ever done, funded by the performed by the National Institute of Dental Research and funded by taxpayer dollars, shows about half a cavity of benefit. Another study, Warren and Levy, showed the same thing. There's no statistical evidence of the larger population studies that this policy is effective. We have better ways, we have better means. In addition, when we're looking for safety and effectiveness, essentially, of an unapproved drug, we surely should be asking for a randomized control trial. Our kids deserve better. We deserve better. We can make better choices right here.
This is one area that we may agree. I actually got exercise because I support it. I support training in here. I got exercise because you were taking such artistic liberty with what's actually going on. I mean, I'm glad the Tribune wrote about it. But this has been a complicated thing that we've been working through for 2 years, of whether we could or couldn't. It has to do with the Practice Act and lots of things. It's not the bill and the Hill. The Hill actually is quite interesting. And we're probably going to pilot that. And I was in Minnesota about 2 or 3 months ago working with Minnesota, the dean of that dental school, to look at innovative ways to do that. I got exercise because you're taking such artistic license with something that so many of us have been working very hard to implement. And it's that sort of simplifying of it and vilifying the Hill that actually undermines our efforts to do it. But we can agree that it's a good idea. And the First Tooth Project, which is training pediatricians to do more oral health screenings and prevent them. Great idea. I'm involved with that. Head Starts. Been doing that with our clinic group and our hygienists now for 2 years. It's very challenging because of funding streams and funding mechanisms, because the Head Starts are already so overburdened with responsibilities. The public schools, the nurses are so overburdened with responsibilities. Those of us that do this daily and work through the details of it, treat Medicaid populations, work with low-income populations, realize it is complicated, it's hard, but I agree with you, we need to do all those things. But I also fully stand in solidarity with all of the organizations that agree with what I just said and what you said, nationally and locally, who think community water fluoridation is the cornerstone of any comprehensive program, because it gives the first line of defense, and then all these other things that are incredibly expensive, take a lot of workforce, dedication, policy focus, those things are secondary. The cornerstone is that primary prevention that optimally fluoridated water provides.
Okay, next question for the pro side. Given implied health problems from fluoridation, a lot of people are citing the precautionary principle. Better safe than sorry. But if the benefits of cavity reduction is valid, is a precautionary principle appropriate? Do known health benefits outweigh unproven health risks?
Optimally fluoridated water will have the greatest health benefit and the least risk possible. There are studies that show very clearly that communities, for example, in Alaska, native communities that live in fluoridated communities have much lower rates of tooth decay than populations living in non-fluoridated communities. In Illinois and Nebraska, they've conducted studies where even children that use toothpicks but live in non-fluoridated communities have much higher rates of tooth decay. I think it's really important to recognize that these studies exist, and they have shown, and in fact, there's studies too from Australia recently that show a significant effect, positive health effect on adults. So at optimal fluoridated water levels, we can make a difference for all of Portland. Again, this is a cornerstone program. This is a cornerstone program that will help to build better health for all Portland.
I'm not going to repeat our criticisms. Obviously, we obviously do not believe fluoridation is very effective at all. But I do want to talk about the health benefits, and they're not just purported, okay? We know there are people that are hurt by ingesting fluoridated water. We know that fluoride lowers thyroid function. We know that fluoride affects the brain. We know that from hundreds of controlled animal studies on both intelligence and behavior. We know that, okay? We know in terms of diabetics that it increases the severity of diabetes. We know this. We also know that diabetics tend to drink more water, as kidney patients do. And the one thing that hasn't been brought up here is that it's not just the level in the water, it's the total dose. You are getting fluoride from food, you're getting it from drinks, you're getting it from pesticides, because fluoride is used in many pesticides. It's this total dose. And what they're not saying is, if you, for any drug like this, or any toxin, okay, typically, the higher the dose, the more harm to the human beings. If you put this in drinking water, you can't control the amount that you get. If you can't control the amount, you can't control the dose. And if you can't control the dose, you can't control the harm. This does not make any sense whatsoever. This is not a one-size-fits-all. of receiving a drug. And it doesn't make any sense to put it in the drinking water.
Okay, next question for the con side. And this question may not take 2 minutes. Who are your largest financial backers? Please disclose any conflicts of interest.
Well, it's kind of hard to have a conflict of interest when you're a volunteer and you're not making any money off of this, which just virtually all of us are. There are a few people getting paid some, yes. I don't think anybody's getting rich on the fluoride campaign. I took a look at this, and the vast majority of our donations come from ordinary citizens who care about adverse effects of fluoridation. And most of our donors are not large. 25, 50, or 100 is typical. And I went through some of the lists of people who were on our website, and a lot of them I didn't recognize, but some I did. And many of them are people that are physically affected by this. They're going to be harmed. Many of them are physicians who know about the adverse effects of fluoridation. And if you look at the voters pamphlet, you're going to see that 41 statements there opposing fluoridation from individuals and organizations. By the way, this set an all-time record for Multnomah County. Many of these are in-kind donations. They paid $400 for their own statements. Been fortunate to get some larger donations of $5,000 to $10,000. We hope to get even more. But you know, this is you can look it right online to get the names. I don't know if they know anything, anybody. But this is a good opportunity to ask all of you, if you haven't donated yet, here's your chance, okay? So just go to our website, don't wait till tomorrow, do it tonight, okay? Do it tonight. And then we want to get donations from all over the country, because this is a situation that affects everybody. Call your sister in Des Moines, your brother in Baltimore, but wait till tomorrow, because if you wake them up, they'll be ticked off and they probably won't give to us, so please. Thank you.
Well, I'll probably do a pitch like that in a minute here, but I want to answer the question first. The Healthy Kids, Healthy Portland campaign has a broad base of supporters. More than 80 community organizations, health organizations. More than 80 organizations, healthcare organizations, community-based organizations support this, have donated time and resources for this campaign. This is a grassroots campaign. Organizations like Northwest Health Foundation have contributed to this campaign. Organizations like the Dentists Association have contributed to this campaign. Why? Because we believe that this is fundamentally the very first and most important step that you can take to improve oral health in our community, reduce health disparities, and move in a positive direction on this issue. We work on a whole host of other issues. Many of these organizations, as Mike has pointed out, work on a whole host of other initiatives that support in our efforts to improve oral health in our communities. But this is a fundamental cornerstone, a building block for improving the health in our communities. So we have a very large array of support from a number of organizations that are contributing their time, that are donating their resources, and we invite you to be part of this movement. So please, healthykidshealthyportland.org. You can donate there and make your thoughts known.
Yeah, and I know I can be feisty sometimes, but I want to be conciliatory and say that I admire the passion that Rick North. I don't agree with a lot of what he says, but if I were in a big dogfight, I'd want him on my side. He's tenacious. So, and I see other people going out and doing public events. You all coming out and giving up your time in the evening after most of us probably work. Even though we may disagree, and I see it in some of your eyes, you definitely disagree with what I've said. Some of you agree. The fact is, this is one of the reasons my wife and I love this city, is because it is so engaged. We may have a disagreement, but after that, I think we'll go to the next issue. And the interesting thing about fluoride is we'll probably agree on most other issues. Yeah, not this one, that's for sure.
Answer the question.
He did.
Okay, so this is our final question before going to closing remarks. And this is for the pro side. It appears that much of the dispute devolves into questions of fact. Can you suggest a way to explore and test those facts? What do both sides agree on? It appears that much of the dispute devolves into questions of fact. Can you suggest a way to explore and test those facts? What do both sides agree on?
I can. I can tell you that when I'm looking at best practice in public health, when I'm looking at best practice with my patients for oral surgery procedures, for antibiotic, for what I teach my students, for when I'm going out, like I'm doing a presentation on Friday around maternal oral health to a state organization. And to do 17 slides, I got through a 40-page document put out by the Health Related Services Association in Washington, D.C. So no, I can't go out and take a body of science and sort of dig through it and find my own facts. What I do is what the overwhelming majority of people that are public health and healthcare practitioners and professionals in this area do, is we look to competent bodies of our peers to evaluate large-scale science literature and come up with recommendations. And not all agree in those panels. You're never going to get, I've been on reviews for grants, and I think there's never 100% unanimous agreement among science. That's not the way it works. You bring the most competent people in the room or on a panel, you get the most data that you can about a subject, and you come to the best conclusion. And you make recommendations. And that's why I have stated over and over in this debate, like a broken record. Regina Benjamin, so just, 2 months ago, 3 months ago, we had a consultant, a physician coming out that was opposed to fluoride. She made it very clear that she thought it was very curious. Regina Benjamin hadn't endorsed community water fluoridation. It took us about a 10-minute Google search to find her endorsing it. Regina Benjamin is a public health physician from the Delta area of Mississippi and Alabama. I seriously doubt she would go against her principles and collude with other organizations to do something that would harm communities. The Center for Disease Control. Like I said, I've got friends from all over the world, and I studied in Sweden. We talked later. The CDC is considered one of the hardest hitting, hardest evaluating scientific organizations on earth, full of competent scientists. That's what I would suggest you do. Look at their final recommendations.
I'll say this again, science changes before policy. It's only a matter of time. We can agree that our kids with poor oral health care need access. We've heard about that tonight. We heard about some of those solutions. We're also in agreement, even those in support of this policy, that fluorosilicic acid has other contaminants. National Sanitation Foundation fact sheet shows that arsenic, lead, copper, and other heavy metals. There's agreement there. We also can agree that we can and need to do more. And that doesn't mean that we use a policy that's never been shown to be safe or effective with a randomized controlled trial. We can also believe that we don't want to knowingly add another toxic burden to our kids when there's reasonable basis for concern. We can agree that there's not scientific agreement, but we can also agree there's reasonable basis for concern.
And if you're asking for facts, let's take this international. 196 countries in the world, 27 fluoridate, 11 for more than half their population. In Europe, 48 countries, 5 fluoridate. 94% plus of the world's population does not drink fluoridated water. Look at the statements of the European countries. One after another, they're saying they do not fluoridate. This is from their health ministries. They do not fluoridate because they have medical concerns, because they have effectiveness concerns, and because they have ethical concerns, because it is not right to put a drug in the water supply where people cannot avoid it if it's going to hurt them and if they don't want it. Those are facts. The vast majority of medical organizations and health organizations and countries in the world do not support fluoridation.